For the first time in a while, we're able to celebrate health. COVID-19 vaccines are saving and changing lives. But here's the thing, a lot of you still have questions about vaccines and variants, and that's okay. We would love to help you find the information you need. Hello, everyone. I'm Susie Larry Hall, and today I'm speaking with Enloe's Chief Medical Officer, Dr. Marcia Nelson. She's here to help answer popular vaccine questions, big and small. Let's get started. Is there any reason to believe getting a vaccine will make it more difficult for couples to have babies?
Susie, the short answer is no. But I'm really glad you asked because that's something that is so personal to so many people. It's so important, and it's also so important just to talk about because there's no need to be afraid of the COVID vaccines if you're thinking about trying to get pregnant. Back in December, there was a really unfortunate article that made its way into the press that had a really scary headline. It said that the vaccines cause female sterility, which means a woman wouldn't be able to get pregnant. And it was just bad science. I looked at the science. I looked at what they were saying the vaccines did, and there's no way they could do what they were saying. And so from all the research I've looked at, the vaccines cannot and don't interfere with a woman's ability to get pregnant, to stay pregnant, and to have a healthy baby. And they don't interfere with the baby's father being able to make the baby. Getting a vaccine for a woman who's of childbearing age is so important because a woman who gets COVID when she's pregnant has a much higher chance of a very severe time with COVID. The complications are much worse for women who are pregnant who get COVID-19. When a woman is pregnant and has the vaccine, she can pass on those antibodies that she makes to protect herself. She can pass those on to her baby. So her baby is protected right from the time it's born from COVID-19. There isn't any reason to be afraid of getting the COVID-19 vaccine when you're pregnant. The National Academies for Obstetrics and Gynecology recommend that all pregnant women get the vaccine. And so I recommend that the women get the vaccine if they're thinking about getting pregnant or if they are pregnant. In fact, my daughter, who's in that childbearing age, she's had her vaccine and her husband has had his vaccine. And I'm hoping to be a grandma before not too long. So in my family, we're getting vaccinated.
This brings me to my next question about kids. Are these vaccines safe for children? You mentioned that if a pregnant mom gets vaccinated, the antibodies pass on to their baby. But what about kids who, right now, what is the recommendation for kids? What does that look like for them?
The recommendation for kids who are 12 and over is to get the vaccine. Now, the Pfizer vaccine is the currently approved vaccine for kids who are in that age range. The Moderna vaccine is approved for older people, as is the J&J vaccine. But for all kids 12 and over, they have an opportunity, and I recommend that they get the vaccine. The vaccines are safe for kids. It's been shown that a year ago, 3% of all the COVID infections were in our youth. And now at this time, it's 22% of all COVID infections are in our young people. And there's no need to have it be that way. We can protect our kids who are 12 and over just like we can protect our adults. The hard thing is that right now we don't have vaccine approval for kids who are younger than 12. They are doing studies for that, and I expect that at some point, hopefully in the near future, that the COVID vaccines will be approved for those younger kids. But until then, we adults can get our shots. Our kids who are 12 and over can get our shots, and that protects our kids who are younger than 12. Because my vaccine protects me, but it also protects you. It protects the people I love. It protects the people I care about. And that's another benefit of getting the COVID vaccine.
I love that. But I want to talk about variants. How does that happen, and what is a variant?
Have you ever played the game telephone?
Yes.
Okay. So in the game of telephone, one person whispers a word or a phrase to somebody else, and then that person whispers it to somebody else. And it goes around through multiple people, and then the last person in the line says, this is what I heard. It is never, ever, ever the same as what it started out to be. And that's kind of like what happens with a variant, is that it starts out one way and it just changes. So a COVID variant is the COVID virus, but it just changes, and usually it changes so that it can survive better, so that it can spread more easily, because that's what a virus wants to do. It wants to spread from person to person and infect more people. So it's kind of like that game of telephone. It's inevitable that it's going to change, and it just makes it stronger.
When we think about the variant, what is it, people who are vaccinated versus non-vaccinated? Does that play a role in how the variant moves around?
Yes, because the vaccines that we have right now are effective for the variants. We have 4 different variants as of today in Butte County, including the Delta variant, which is the one that has been causing so many outbreaks, severe outbreaks in countries all around the world. So we have the variants here, and we know that our vaccines are protective against them. So those of us who've had our vaccines, we can breathe a little easier. Well, a lot easier, but for those who have not been vaccinated, that would keep me up at night if I weren't vaccinated and I knew these variants were around, because one of the measures of how serious a viral infection is how many people get infected. If I were to have a COVID infection with the original COVID virus that came out in early 2020, I could reasonably be expected to infect maybe 2 people, maybe 3 people. With this new Delta variant, I would infect 8 other people. And then those 8 people would infect another 8 people each. And so it just goes from one case to many, many, many cases. Now that we're moving past the really terrible wave that we had at the holiday season this past winter, it's easy to forget about how severe that is and what that looks like. But people lose their lives from COVID. People have permanent changes in their taste, in their smell from COVID that changes their lives. People are separated from their loved ones because of COVID. And I don't ever want to see that again. I don't ever want to repeat what we saw over the December, January time period. And we don't have to. If we all got our vaccines, we would be out of the woods.
Another common concern when it comes to vaccines is how quickly they came to fruition and how fast they seem to appear. Can you talk a little bit about the vaccine?
I get that, because usually we think about science and we think about processes that take years and years and years to be able to finally come to fruition. I mean, I think of like a Nobel Prize for science. Usually that's for something that was done decades ago. I'm so thankful that science moves forward, because the science that gave us our COVID vaccines in less than a year time has been around for over 30 years. So it's not new science. It's just that we never had a pandemic like this before. So our scientists, our best scientists have been preparing for decades to be able to give us this vaccine quickly, efficiently, at relatively low cost, and above all, safely. So it's not new science. It's just we never needed it before.
That's great. And another common question we get is, which vaccine should I get? You explained earlier who's eligible for which vaccine, but what's the difference, or how would someone determine which vaccine's best for them between Pfizer, Moderna, and J&J?
Get whatever one you can get. That's the short answer, because all 3 of those vaccines are excellent. It's kind of interesting when I think about vaccine effectiveness and compare it to, for example, our flu shots, that every year we're saying, well, was this a good year or was this not such a good year for a flu shot's effectiveness? These COVID vaccines hit it out of the park. They are so effective, like over 90% effective, and we have them at the asking. All we have to do is go and roll up our sleeve. So whichever vaccine you can get, please go get it.
Good. I like it. My final question is about masks. We're still wearing our masks. Yeah. There's been new recommendations. Can we share a little bit about what that looks like moving forward?
Well, the quickest way for us to be able to get rid of masks is to all get vaccinated so that we can move past this pandemic. But right now, for people who are unvaccinated, whenever they're inside a closed space, they need to be wearing their masks because this mask protects the people that are out in the community, the people that you might care about, people who have had their vaccine. They can go without their masks in a lot of situations inside, although not in healthcare. And that's really nice to be able to know that you're still protected, so you can have that sort of freedom. But you always need to be following each business's particular rules and regulations, because a business can say, I want you to wear a mask, or they can say that if you're vaccinated, you don't have to wear a mask. But really, for folks who have not had the vaccine, they should be wearing their masks in closed spaces.
So would that again mean any child that's under 12, so they should be wearing their masks?
Kids under 12 who are unvaccinated should be wearing their masks in these indoor settings.
So Dr. Nelson, you'd mentioned that things are changing for those who are vaccinated versus unvaccinated, but you mentioned that it's not so for the healthcare system. So what does that mean with masks here at Enloe?
In healthcare, we're all still required to wear our masks. If you're vaccinated, if you're unvaccinated, we all wear our masks. And the real simple reason is because in healthcare and here at Enloe, we want to go above and beyond to take care of our patients. We want to make sure that everybody who comes to Enloe knows that we are taking their health seriously. People who come to the hospital are the sickest of the sick. A lot of them have weakened immune systems, and my mask protects them. Even though I'm vaccinated, it's something that I'm happy to do because it keeps my patients safer. And so everybody who is a caregiver at Enloe wears their masks. And we ask everybody who visits somebody in the hospital to wear their masks because, again, their mask protects our patients.
Thank you, Dr. Nelson. And thank you so much for watching. We all need good information to make decisions for our families. So thank you for doing your part to understand what's going on. We hope you'll consider vaccination if you haven't already, both for yourself and those around you. Join me next month for our next Facebook discussion. Take care.